Hello, everyone, and thank you for tuning in. As usual, my name is Harriet Amefuna, your host. So, last session, we discussed neuropathy. And since then, I've had a lot of calls, questions, bordering on treatment options. And based on that, we now said, okay, why not have a deeper focus on neuropathy with reference to, discussing the more practical approaches when it concerns treatment. And so based on that, I'm actually bringing somebody to the house today who has the experience, who has the clinical approach, who deals with this condition and situation on a daily basis. Some of you who are my friends would definitely know her, and some that based on them having this condition would have met her. Well, this person was actually my schoolmate in the medical school, College of Medicine, University of Lagos. Well, let them not just say so much. I present to you Dr. Sola Adeboyejo. So hello, Shirley.
Hi.
Thank you for coming around and let me say bailing me out with so many questions and all that.
It's a pleasure.
So how do we start? I think I'll start this way. So I know you as Shirley from school, but who is Sola?
Sola is a physiotherapist, a director of physiotherapy, and an associate fellow of the Physiotherapy Postgraduate College of Nigeria. I'm a director of physiotherapy with Lagos State Health Service Commission. I head the physiotherapy department of Massive Children Hospital, Lagos Island.
Okay, so Shirley, I remember some time ago I came to you with reference to my diagnosis. Let me just go neuropathy, spondylosis, and then you advised to me based on the treatment option. Although here I've actually shared my story.
Yeah.
But during my session here, in talking about neuropathy or spondylosis, I actually just touched peripherally on some of the topics. But based on the questions that have been coming in, I'd like us to, to throw more light and, be able to dissect this topic, neuropathy, as it borders on be it cervical spondylosis, be it lumbar, and the causes, effects, and all that. Let me start with, the causes of neuropathy. Like I mentioned on my last session, most of it for the layman, we say it comes in the form of, the numbness, tingling sensation, pins and needle, quick sensitivity to touch, pains, joints, ankles. At times, people can't even move and all that. So I don't know if you have other symptoms that have not been able to mention.
Thank you so very much. First, I want to make it simple. When you have said neuropathy, is a two-word brought together. Neuro for neurological, neurons, pathy, the pathology of it, the disease of this. So in our bodies is the nerves that transmit sensations, that transmit signals, and we are able to act based on what they are able to initiate in our muscles. So if there are injuries to this, I will try to use language that people will understand. Yes, I avoid a lot of jargons. The nerves that we have said, they can have injuries, and there are three types of injuries. Typical injuries, which we can call neuropraxia, we have axonotmesis, and we have the neurotmesis. I will just explain. The neurotmesis can be an inflammation of the nerve when there is trauma. If there's trauma, injury. So like we have a wound. If you have a wound now, before like the second, third day, it's swollen. That's the inflammation. And inflammation is part of healing. It has to happen for all the infiltrates, the blood cells, to come in and heal that part of the body. So when there is a neurotmesis, the prognosis is how soon we get well. It's usually better and good compared to some others. We have axonotmesis, that is in that nerve structure. There are joints, like I will say joints in it, where they can move and there are parts in it. So if a portion of it is cut off, severed, that is also an example of a nerve injury or a nerve damage. And we have neuropraxia. Praxia is compression. When another thing is resting on that nerve. Even swelling can cause a compression, because that part of that swelling, there's fluid around there. It's going to be complete with the space for the nerve, and the nerve will keep sending uncontrollable signals that it is not meant to be. Or if there's what we call contusion, those are all swellings, they can cause that. So those are like examples of damages that can happen to a nerve. Now, causes. based on what we have said, you can give us an idea of causes. The causes could be trauma, if there's an accident. If one could have severe laceration. For people who have a laceration to their wrist, and before you know it, they can't move their wrist again because the nerves that passes here to control the muscles that help in movement has been cut off. There's been an example of neurotomesis. Like I've said, so if there's a laceration, now I can also bring that now to our vertebrae. You know, our spine runs from just below our head, the skull, down to where we call our tail. Yes, so the spine runs, and the vertebrae, they are in segments. They are all 33 all together. So we have them run from the cervical to the sacrum. The sacral part is fused. So the free ones that I segment are from the cervical up there to the lumbar. Yes. So we have the cervical region, we have the thorax, that is the one on the chest area, and then the low back, lumbar. Even for our low back, the lumbar, we have what we call the upper and the lower. If there is an upper back pain, that will be from like our T12, the thorax level at T12. That's down the chest down to the L1 part of the lumbar. Pains can occur at different segments, and these pains, when they occur, they have different reasons why they occur at those segments. Like now, if you have a cervical pain, which now we have even tagged tech neck. We call it tech neck because of the advent of technology. People stay a lot on their computers, on their systems, on their phones. So this is now making you bend your neck forward to be on it. Normally your neck should be erect, but we find ourselves that when we are on our system, either it's a laptop, even the computers or our phones, we are always bending forward. And even if you try do what I'm trying to explain now, if you put your neck forward, you can feel a little strain on your neck muscles around compared to if your neck was up like this, because that's the nature we call the normal anatomical way the neck is supposed to be positioned.
So thanks, Shola, for that explanation. Okay, in my session last week, like I said, I just just peripherally touched on all areas. So in talking about the causes, I would like to list them one after the other as I explained. So let's look at aging. Let's look at the relationship between aging and neuropathy, be it cervical, be it lumbar spondylosis. So what do you have to say with reference to aging?
All right, aging. The way I would do the analogy here is our cars. They have shock absorbers. So with time, as you use them, your mechanic will tell you that your shocks are already going down. So over time, there are these discs in between one vertebrae and the next. Aging, as you age and you use, they start losing their heights because this height is getting to be loose. The shock absorber, the natural shock absorber, which is the disc, is going to start shrinking. It can even get that bad that the fluid in it, which is like your grease in your shocks of your cars, is getting to escape. So when they are escaping, they just don't escape. There's no vacuum in nature. When they escape, they form somewhere and become solidified. So when they get solidified, they start staying out of all these vertebrae, the disc side. There are nerves that we call offshoots, spinal nerves. They come out from there. And so when that happens, the disc height is reduced. So the vertebrae up starts resting on the one down.
Definitely.
And the nerves that passes through them, it rests on it. Your disc that we said the natural shock absorber is also losing its own fluid, and with this, such to aging contributes to it.
So there's a collapse.
Yes. So that is where we now have intervertebral disc collapse. So that is how I can correlate that with aging. Yes. And for some, even before the age really advances, tear and wear, which is another cause you have mentioned here now, could occur. Because when you have repetitive use, the more you use something, the older it will get fast. Degenerative.
Labor, hard labor, they're kind of work. Does it apply to people like that?
Very well.
Pushing of barrow,
carrying heavy load, egg pans.
So, and this also brings me to, I mentioned our children. There was a scenario, there was a case I mentioned. An uncle of mine called me that his son, the boy is just, I think he's in SS2 or so, or SS1. I started having pain, waist pain and all that. So I went to the hospital. It was still a kind of, you understand, spondylosis, but not, so serious. And for me, I wonder, for such a young child, we asked, does it carry everything and all that? So with reference to this, what must have been the cause of this? And how do we protect our kids, you understand, from, this, will I say, being exposed, from, early onset of, neuropathy, be it lumbar, be it cervical?
Yeah, thank you for that question. There was a time I'd done a documentary on children carrying heavy backpacks. It's been fun for anyone, especially children. Your backpack should not be more than 10 to 30% of your total body weight.
Definitely.
That's what your back can carry conveniently. So you find these children, when they go into school, probably they have not given them a timetable, or they are lazy about sorting their books. They just pack everything. So when the teacher comes, they bring out that particular subject note instead of having to have done it according to their timetable. And these days also, some are in the hostel. Their mattresses, school don't change it too often. Their mattresses become buckety. And so when they lie down on it, their back sinks into it. Whereas the way nature has made our low back, the lumbar vertebrae, is to have a slight S. Yes, we call it a slight S. It's not straightened, it's not fully curved. So by the time that mattress does not allow for a slight S, rather it goes deep down and make it buckety. Over time, the body starts noticing it as pain. Pain, like I always say, is a signal. Body is sending signal that there's something wrong, correct it, do something about it. So the muscles go into shutdown. We call it muscle spasm. By the time you do an x-ray, you're saying there's muscle spasm because the curvature is already being further strained. The more muscle strain, spasm should occur for a long time, the muscles will start shutting down, and that will even aggravate, and that's when you can have a straightened back instead of having that slight S curve. So for children, that's yes, very much. And parents who probably are into cells of things, and the children are the ones always lifting those heavy loads. They'll say you are a child. Yes, you are saying you are a child. You still to go on and carry heavy pockets on their heads. All these compresses, and they had what we call family history. In families where this runs, it will make it start off earlier than their peers. So those are some of the reasons.
It brings me to the aspect of even our little kids. I have 6-year-olds who most times want to be on their computer games, their phones, and the way they they lie on the floor, the way they position their head. You understand? In watching the games and all that. What do you have to say to that?
Yes, that
even in schools. In schools, sitting position. There are benches, even for us, even growing up, when we went to school, there are ways that we sit,
have to bend
our back, our neck and all that. So it's not that maybe in schools, you understand, that this should also be taught, and to ensure that kids, you understand, sit the proper way, that good posture should be of importance.
Right, from early age.
From early age, kindergarten, nursery, and all that.
There's what we call ergonomics. Ergonomics has to do with your workstation adapting to help your posture, either while sitting or walking, so that it's not compromising your spine. Your posture while sitting or standing matters a lot. And that's why even this advocacy for schools, workplaces, it's ongoing under ergonomics, so that the sitting posture at work or in school would not be of an adverse effect. So the table should be such that a child can write without bending over to write. Yes, they should write with their heads at, look at the tape of the blackboard or the boards, and write straight on like this without having to bend over. So also in the offices or industries where even heavy objects are being lifted, they should have ways of lifting it or have what we call a back support that are meant for weight lifters or load, so that the back is reinforced and will not allow for that slip to happen.
Okay, in saying this, so let's also look at the sedentary lifestyle or work style of some, especially the tech, you understand, workers, when I say 9 to 5, your decks and all that. There was something you mentioned the other day about calf and leg exercises while you are at work. You need to sit all day on your table. Because I know that normally you're supposed to, even if you have at least every 5 minutes, 10 minutes, you should be able to, stand up, walk around, and come back to your table. But in cases where you're not able to do that, if you throw more light on, you understand, you mentioned about the calf being also helping in circulation and all that.
Yeah. Now, the advent of after COVID, people find out that they can actually work from home, that they don't have to always go to the office every time. So even when they're in the offices, they work on their system. So they made it a little more flexible. Yeah, now you get to see it and you're communicating with the outside world. But what one should do, even there's an app now that if you have been on your system for more than an hour, the system will shut down temporarily, so as to allow you get up, stretch your backs, stretch your legs, or do as if you just want to go and use the loo and be back. It's been found that, and it's now said that sitting for long sitting now is now the nicotine of today. It's just cigarette smoking as so now the one that is killing now is this prolonged sitting at our desks. So what we always suggest is that, supposing it's a long period of meeting, like in my own hospital when we have HMC and it's staying for long, I just tell the MD, can we stretch our backs? Even if they don't say, I just try to stand up and go to the bathroom. At least that I have walked and eased and stretched my back and be back to the meeting. But we can inculcate this into our meetings. It's for everyone's group. We as physiotherapists, we started going out even to some offices, gone to Ministry of Staff, we met with them, we taught them some stretches because we know they too. They stay for long hours at their desks so they can stretch their backs, even their necks. Because for you as a clerk or a secretarial person who is always on the system writing proposals, getting to meet people online, your neck, you need to stretch those muscles, you need to move them so that the tension around the neck muscles is reduced. And we say the legs, even if you are not just sitting, if you are on the air and your air travel is going to be a long period, you move your feet. We call it ankle pump movement. When you move your toes, you move up to your calf, because the calf there, like we say now, is the arch on that side that brings the more of the blood flow back, to the arch. So with that, it keeps moving. It prevents what we call deep vein thrombosis, which is a very dangerous thing. Yes, if it should happen, the embolus can go as a blood clot. It can go into the lungs or into heart, and the rest we can want to imagine.
Well, you mentioned an advocacy or maybe a proposal to some companies on teaching their staff. Maybe in most of the tech companies or where people used to sit on the system for a long time, some of these exercises like you mentioned, so that to be incorporated, and every staff, should be able to know that, for the fact that I'm sitting too long, I should be able to do this, be able to prevent some certain things that might happen. Okay. Then you look at gender. Where do we have neuropathy the more? Is it in the female or in the male? But I'm more concerned or more, well, I'm a female anyway. So let's talk about
bias. All right then. When we're talking about neuropathy, that's especially when it comes to a degenerative disease, the female seems to have it more. What predisposes is during pregnancies.
During pregnancy, what happens?
Yes, when you're pregnant, the tummy is forward and the back start moving inward because now you start tending to do your tummy. Even some people, even when the pregnancy isn't up to that level, they're already doing like yes. And so when you do like that, your S, your natural S is exaggerated, and that puts some strain on the back, both upper back and lower back. We have what we call women health physiotherapists now. They help work on that so that during pregnancy and afterwards you can regain back your muscles. Because those muscles that you were not using while pregnant because you have done like this, they will shut down, they will become weak, and that's also not helpful for the spine. Then also as women, the fact that even our knees are predisposed during pregnancy, you add weight, so your knees have more work to do. So repeat, and then the hormone relaxing during childbirth, it relaxes all your ligaments. It's not just going to relax the pelvic ligaments alone, it's all over the body. So before you know it, the knees, the ligament there are weak. They are not going to carry your weight that you have gathered during pregnancy over time. So all this.
So are you not advocating that women after pregnancy should have some special exercise?
Yes, we have women health physiotherapists who does that.
But you know, some people will have this argument that it's not common, that they've not seen women that why they exercise after the.
You know, the problem is that there wasn't fine, you know, like we call exercise. Exercise is different from activity. Exercises are targeted at certain muscles. They are targeted at certain parts of the body. Exercise is also a prescription thing.
Yeah, definitely.
You have what you want to do, what you want to achieve doing it. So it has to be prescribed by a specialist. And before the specialist would prescribe, it would have to assess you. There was a day we went for a training, and this women health expert told us, she gave us one stick and we were to do like this with it. For some people can, even though they are not fat, they couldn't, because over time, those muscles that were weak, yes, and they could not, and those who could do it with pain. So all these, and your pelvic floor muscles, you know, with the weight of with the weight of the baby over at that stage, it comes down on some people, even they have incontinence. Before they get to the bathroom, their bladder is getting, they have peed on themselves. So these are things a women health person will take care of. They do, like we call Kegels exercises. Yes, they will go through all of that.
Stuff, you know, backing babies, women, you understand, they carry babies on the back. Some will still carry heavy loads and all that. So I'm sure that also contributes.
Is a contributory factor. Women and the chores in the home, you know, some want to kneel down to scrub. They want to do too many things at a time. And prolong standing in the kitchen. They are standing.
Very guilty of that. You know, you come back from work and you wash in the kitchen, drop my things on the dining table, and I'm into the kitchen. And I'll be in the kitchen till
and that's after you have had a long day. So you must learn how to pace it. You can sit with your back supported. You can have a good seat in your kitchen and do your chopping of all those things you want. And it's just when you're going to do this, but at least it must be paced, not just so stretchy like that.
So that we don't become called bias. What about the men? You know, we've discussed about
yes. Our men, you know, in our environment, we believe they are the breadwinner. They have to go all out and do a lot. They also have their own, you know, what we call tendencies, the risk factors. Like now, you find it's more of men that do all these laborious jobs. They go all out to do, they even at home. When you go to the market and you buy your bag of rice, you just leave it in the boot. You are waiting for your husband to come and be the one to carry it for you. You see, by the time
it's a stronger gender.
That is it. By the time your 40-something-year-old man carries a bag of rice for you today, another time he does it, and he still does some other things as well. One day as he's going to bend down to buckle his shoelace or tidy up his, you just hear his snap. Most people hear them say, it was when I wanted to bend down and tie my shoelace. I wanted to bend down and scrub my feet in the bathroom. I heard a snap. and that is the beginning of it.
Mm.
So the earlier some of these things are even prevented. If you bought your bag of rice, please, in your car there you can bring a bucket, open it, divide it into 2 or
But I
3.
want to say this, but if he had been somebody that has been exercising, you understand, his muscles, you are now relaxed, and they're using, he can still carry that, knowing the right way, you understand, to lift it. And
You
all
don't.
that.
This person is not a natural weightlifter.
Mm.
Even those are natural weightlifters. Don't forget, they have this band they put at their back
Yeah,
and
so
their groin.
yeah.
So they are not only protecting their backs alone, they are protecting their inguinal, the canal. If you carry it every way too much, the structure there can move into your groin. You now have inguinal hernia. So carrying a 50 bag weight for it doesn't show how macho you are. You are rather endangering your back. You have trolleys. That's why those trolleys are there. And if you have to bend, even to carry anything.
So are you now saying you stop carrying 50 kg bag of rice?
When you get back home and just
like me today, so many people are not buying 50 kg.
Buy
25.
Yes, so my sister. So let us not endanger their health.
Okay, so having said that, where is the place of nutrition?
Nutrition, of course, plays a lot of vital roles. We know our bones, they need vitamin D, they need the early morning sunshine, they need our vitamin C, and our eating of vegetables, folate rich food, fruits will help absorption of all of this. Though some people genetically, if they have issues, like those who have rickets, they have malabsorption of their vitamin D's and some, and then they have to get supplements to make do for what they cannot get or absorb directly from their food. So such, but for now, I'm not a nutritionist, but from overview and what we have learned, there's this Mediterranean diet that is believed that when you have a plate, you divide it into 4 portions. A portion is for your protein, another for your carbohydrate, the third for your fruits, the fourth for your veggies, so that you can have a well balanced, and you drink water enough to move the food and your gut bowel, the bowel also to be in maximum. All of this is a combination of different factors all brought together.
Okay.
And we believe that there are some foods that are very sugary. It's believed that sugar, a lot consumption of it, flares up arthritic pains. It flares up inflammation.
Okay. You're talking about neuropathy. We have the different types, retinopathy and all that. But I also want to discuss the very important factor, which is the diabetic neuropathy. That is diabetic patients, you understand, and neuropathy. So please, could you throw light?
For the diabetics, the problem they have is that they don't have enough insulin being produced to use up their sugars. So their glucose, their sugars, as we say in layman language, is flowing freely in their blood system. It's not getting to the cell level where it is to be used, to release energy. So as a physiotherapist, it's been found that exercises also help use up these free, yes. And when the sugars are helped, it reduces even the chances of them having neuropathy, diabetic neuropathy. Because when the sugars are not well used, on their feet, they start having this non-sensations. They can't even have feelings.
Numbness.
That is even more dangerous. Because when they march on dangerous
pain,
they don't have a feeling for it. So when they do their regular medication combined with regulated prescribed exercises that they can do safely, it should do a lot to help them. And as physiotherapists, we do treat the diabetic neuropathy as well.
Right. Now, we'll look at intervention treatment options. Surely, when I came to you, I called you. I said, surely look at. So I'm planning for surgery. And you laughed. You said, Harry. And we know definitely well that for surgery, surgery should be the last option.
Yes.
And there was something you told me. You said, Harry, come over. That we can treat this. come, and with my results, I came to you. And as I speak to you today, here I
It's
am.
God.
And my neuropathy was sorted out. So, what am I trying to say? What I'm trying to say is, in neuropathy, be it spondylosis, be it other forms of either cervical spondylosis or lumbar, and all that, must it be surgery? What interventions, you understand, should one look at? Is surgery the best option? So what are other options? What should be done?
Thank you. You know, during the course of this interview, you had asked for causes of it. And then causes should also determine the treatment options available, and that will suit the very cause of this neuropathy, be it cervical of on origin, the lumbar, or the diabetic neuropathy, as the case may be. For the causes, if it is a fracture on the vertebrae, for a physiotherapist, is a no. It's contraindicated. Yes, it has to be. Yes, it's going to be surgery. The surgery has to fix the fracture so as to prevent further injuries by like a cord compression that can make the person become paralyzed. So for that, physiotherapy would not at all be an indication. Can now be post surgery that the physiotherapist will now come in to manage pain and muscle weakness, so rehabilitation as a whole, to get the person back on his feet. So now, if it is like we have said, the types of
Neuropathy.
yes, or nerve damages. We said if it is praxia, compression, we can look at if it is the nerve that is entrapped by an osteophyte, that is we said the vertebrae is collapsing. So we'll find a way, we call traction. We'll distract, we'll move that vertebrae.
That was what I had.
Yes. So we have some particular manipulations we can do and do safely. This is not taught at undergraduate level, it's a postgraduate level. It is a specialized part whereby
when I was
you
going
do
through my
manipulation
course,
safely.
as it was kind of scary, the angle you would take my neck to and all that. I was kind of scared that what if at the end of the day, it was funny anyway.
Yeah, I understand. Yes, it's always like that. So we could do that manipulation safely, and once we are able to distract, remove the pressure off the nerve, healing will start taking place. And while the healing is taking place, we start strengthening the muscles, because after they have been cut off from their supply, they start going weak. So we'll also take that. But the first thing is to remove the source of compression, which we can do manually with manipulation. So that's about that, if the cause is that of a compression. And it's adenomasis. There are some that can get to heal, where they give some supplements to help them call myelin sheets to heal. And why it's healing.
So looking at the B vitamins and all that.
Oh, yes. So while it's healing, you can now talk of your lumbar bracing, cervical collar, so that it is limiting the movement to aggravate further compression or injury while healing takes place. And while the healing takes place, when you come for your physiotherapy sessions, we remove the collar, the braces safely, treat like, and we could use TENS to relieve pain. TENS is very good for nerve pain. It's good for radiculopathies generally. So we'll do that and safely do one or two manipulation on that side, so that the cervical vertebrae don't become stiffened too. Because with time, if you just wear it, it's like somebody who has POP on his knee. By the time the POP is removed, the knee is stiffened. We don't want the place to become stiffened. So we move carefully and safely and have the brace back, so that it still keeps in a safe position that will not further cause any damage.
I see, most times you see people wearing collar, you understand, big the cervical neck collar, or be it at times
In the
lumbar. I
lumbar
actually had a
brace.
friend, a
Cause-
pharmacist,
Yeah.
that there was a time he was actually in a bad shape
Mm.
and he was already bending over.
Mm.
He's a young man in his, let's say, 40s.
Mm.
And he was already bending over. And for me, it was kind of scary.
Mm.
But he used the hospital and he was prescribed the
Lumbar corsets.
and surprisingly,
Mm.
he's sound and straight.
Yes.
And his posture, he
It's
regained
corrected.
his posture.
Yes.
So, and I want to ask a question. In wearing this brace, is it for life? Or do you use it once in a while? What happens? When do you use it? When don't you use it? And even for the fact that, okay, he like my friend or I, he is better. Does it mean that intermittently, once in a while, he still goes back to wear the collar? When do we wear this? For example, like recently I still had some pain and all that. I went back, I put on my collar, you understand? And after a while, I was okay and I dropped it. So I want to ask this question. Even after dropping the collar, when do we still have to use it?
All right, thank you. When it just happens, it's right when it's cervical, we'll say, okay, for the next 6 weeks, you wear it. And depending on the severity, we have types of neck collars. We have the one with the chin support, so that it gives you that distraction, and the traction force is sustained to prevent the compression on the neck. And the soft one, which we advocate to wear at night. Mind you, when you are sleeping, you don't have control on how you place your neck. So you might be putting your neck like this, and that's the position that aggravates your pain further and compresses it further. So we would advise you wear a neck collar, like the soft one, to bed at night, so it can keep your neck without causing more injury to the cervical region. And once this is sorted, the early pain, the acute stage is well controlled, and the person is now keeping to instructions on the workstation, the eye level at which you use your system, even while writing, that you don't bend over to write, so that you don't go back compressed.
Yes.
So with that one, the person should do very well. No heavy loads on the head that can compress the neck back.
Carrying load.
Yes, or heavy load that put a traction force on the muscles around it. Because all the spinal nerves that comes out, they all supply the muscles around it. So you don't want to stretch or unduly stretch them. So those are things you are. Then for the back too, we had said that there can be a shift on the backbone or a collapsed disc. So if the collapsed disc has moved, you don't want to further do anything that can now make it shift.
Definitely.
So that's why the brace. The person is bending over because if he stands straight, it keeps straight on the spinal nerve that gives him pain. So it's compensating by doing like
sport. So
yes,
doing
so that's it. So it was not only the brace that actually helped him. He was wearing the brace, and I said we'll still go for physiotherapy sessions where the brace should be off. He will be treated. Part of the treatment could be TENS, which is good for radiculopathy. Also, some exercises will be prescribed after having assessed, because there are some exercises that are contraindicated.
Definitely.
And there are some that will just be perfect. That's why I cannot tell you do this one that I was taught. I have to be assessed, and then like some will do like this and they feel relief, and some they have to go like this to get their relief, depending on their diagnosis. So that is
okay. Then I mentioned, he said, do you need to wear the collar? You didn't answer the question. As in, is it for life? Or
like I have said,
you have pain?
like I have said, it's not for life, it's a period of time. Most times 6 weeks, depending on the severity. If you are started with the hard one, the one with the chain support, gradually we win you over by using the soft one, and from there to using it only at night. And if you are able to really cope well, you don't have to use it again. You will now avoid anything that can cause a flare. Yes, that can bring a relapse, like having to now go back to your. I remember managing a woman, she had back pain. So by the time her pain was relieving, she said she started sweeping. I said, no. I'm not saying you should not sweep, but don't use broom. That will make you bend your back. Use
long
yes, or long brushes.
Yeah.
So I said, don't say because you are now feeling well, you've now forgotten all the instructions. We call it back school. We give you all the instructions as to what to do to keep you going healthy. Don't forget that a degenerative thing, your shock absorber is bad. You've got to replace it.
Definitely.
And that's what the surgeon wants to do. But our body system is not like that.
It's not like that.
So yes, you still have to start healing. And those healing different body types. Some might even have underlying pathologies that will not allow their wound to heal well. If somebody is diabetic and is not well controlled, the person's wound will not heal fast.
Definitely.
It can even be another risk factor for other things to happen. There can be infection during surgery.
Definitely.
So all this, so you want to weigh going for the surgery or going through physiotherapy, doing it well and keeping to the instructions and then living a qualitative life.
Okay. Even with my colleagues, there's a colleague of mine who've had this question. What is the right way to sleep? When I started having this condition, initially as at 2016, when I was told to always sleep, I was also using the pillow to sleep and I should sit straight on my back. And I'm somebody that likes sleeping on my side. So I want to understand what is the best for everyone. What is the best?
Well, what we will say, if you have back pain, we will not advise you to sleep on your back because the weight of your body is going to be on your spine. But to put off some of the weight of your spine, we advise, put some pillows under your knees, under your back while you do that.
On your back.
Yes. Or there's what we call a quarter turn. You're not sleeping on your side fully. You're just doing like this. A part of your trunk is like facing down while your side is resting. So that you're not resting this side on the other side. You don't want to bear the weight of this part on the other side. And you don't want to further compress the nerve by resting on the other one. So you use pillows. We can even put pillows in between your knees so that all the weight is not on that. So those are ways that you could do to be comfortable while one sleeps.
Okay, Shirley, in talking about exercises, it's not, you hear exercise, everybody believes that everything is exercise. I remember when I was just diagnosed of having, spondylosis. I was just told you have to do exercise and all that. But I found out that it's not exercises that is actually good. Rather, some would actually cause more harm than good. So, well, like I say, some have lumbar, some have cervical. So, but in my own case, I know there's some exercises you also told me to be doing and all that. But what exercises are actually beneficial or good to both those that have lumbar and cervical, or you can still differentiate, you understand?
All right.
And what exercises shouldn't anybody that has neuropathy even do?
All right. Thank you so much for that question. These days now, people go Google and they want to ask all their questions, forgetting that each of those things, they write at the end of them, consult with your physician before you do them. Like on the low back, this lumbar spondylosis we see can be types. Can have what we call spondylolisthesis. And when we say spondylolisthesis, the vertebral bone has shifted. So for someone whose vertebral bone has shifted, there are some exercises you will not do. Rather, it will cause more damage. And that's why I use the word at the onset that you have to be assessed. It is after being assessed and a proper diagnosis is being made that exercise can now be prescribed and designed for your purpose.
Condition.
Yes. When we say listhesis, we can have a posterior listhesis, that is retro, the bone shifted backwards. For such a person, you will not tell the person to do this exercise, whereby he has to some call it plank. You lie face down and you now go like this, or even standing with your knees not bent, you go like this. We'll tell you if you are doing this and there is pain, stop it. Some, they can tell you, oh, go reach your toes. You know, these are different things. And some, it can even be while you are seated or lying down. You are told to hold your knee to your chest, hold the other one to your chest. Different types of exercises one can be asked to do. But these has to be tailored to your need. If you have a shifted vertebrae, you wouldn't do that because as you are doing that, it's exposing, yes. So you do what can only open up for the nerves to be healed. And while there's such a shift, we recommend a back brace so that it doesn't further shift. But not only the back brace, we have to do what we call strengthening exercises. Like I told you earlier, that when you start injuring this back, it starts giving you pain. It starts going to muscle spasm. X-ray will say there's muscle spasm. Muscle spasm eventually will make the muscles shut down. The hand's going to be working again. And that's why somebody will start bending to this side. When one is bent to one side, the muscles on this side are not going to work. Is this one that we are using that will be working? Now, we have to start strengthening those muscles so that they can start bearing the normal alignment of the vertebrae. Definitely. So now I want to do strengthening exercises. We have to tailor it to the bed. The strengthening can just be like, as I'm seated, we call it back stabilization exercise. I'll just put my hand under my leg like this. Yes, and tightening. As if I want to hold. Yes. Thank you. As you are tightening, you can even feel the muscles around your abdomen. Your back contracting. So exercise is not until you go to the field and start. No, we prescribe it based on your need after assessment and proper diagnosis has been made.
Okay. So finally, when do you have surgery?
Yes. Surgery, as I said earlier on, is a trauma whereby there's a fracture to the vertebrae, or when physiotherapy will not relieve your pain. Example of such is people who have caudal equina. Yes, that is the, you know, where the spinal cord stops. Our spinal cord stops around that L2. It doesn't go into our bone. So we now have one like small, we call it caudal equina. If that is trapped, it's a type of nerve that it works independently. We can't control it. That's the one that controls our bladder, our sphincter. So the person will just have incontinence. So it has to now be surgery to correct that. After that has been done, physiotherapy can now start. So that's an example of
when the pain cannot
cannot be relieved, and when there is an injury or there is a cord compression.
Actually, today has actually been very, very educative and insightful. Having talked extensively on this, so what would be your advice generally to everyone? Because like in my last session, I mentioned that this condition is something that is affecting both the old and young, and is actually becoming more rampant. You understand? Everywhere you see people having pins and needle, having arthritis, one thing or the other, neck pain and all that. So what would be your advice to both the young and the old, and the lifestyle that will be able to help?
Right, thank you. Key words I will use is that exercise is life. Exercise is medicine. Keep moving. Avoid sedentary lifestyles. Avoid what we call the new tech thing. Yes, whereby you are glued to your system for hours. Even if you have to put an app or an alarm whereby you have to get up, stretch your backs, gentle movements while you're sitting like I've described. Move your toes, move your legs, tighten your buttocks.
The muscle.
Yes, so that they are not just there. If you have to sit for long, your chair must be supporting your back. Can put pillows so that your back is supported at each time. The back should not be hanging in the air. It must always be supported. So, and if there is any thing you have noticed, please see your general practitioner. And in these few days now, physiotherapists are becoming first contact. We have been trained to be able to know when it's mechanical pain or organic pain, and a red flag is being, and we can refer appropriately or treat as need be. So if there is anything, please Google is not, or your WebMD is not your medical doctor, it's not your physiotherapist. When you see exercises online, except you don't have any, except you don't have any underlying pathology, you can do. But they always put at the end of it, consult. I've had to treat a gym instructor before. He couldn't answer, he had to come. And I told him, oh, you came quietly to treat yourself.
What message are you giving customers?
Yes, I told him that when somebody has a back pain, don't tell the person go do planks. No, you don't tell a back patient to do sit-ups. They are contraindicated. So your exercises must be prescribed by a physiotherapist who not just know the anatomy, he also knows the physiology and everything behind it. Yes, we do exercise therapy. It is exercises that are targeted at treating conditions. Do your exercises, aerobics, all those ones, when you have no pathology, no complaints. And once there is one, please see your doctor who will refer you appropriately.
Wow, Shirley, I wish we could go on and on. It's been very, very exciting, insightful, and very, very educative. And I've had a lot of, take home from all what we've had on this session. But most of all, exercise, like mentioned, is
it's medicine.
It's medicine. Keep on moving, irrespective of where you are. Sitting down does not stop you from doing that. Walking does not stop you. Even nowadays, you have the face yoga. You understand? Even face exercises and all that. So that's it. So thank you very much.
It's a pleasure.
I appreciate this moment and session. So to be able to reach, so that I won't be bombarded with so much questions, calls, messages, and all that. So I think it will be proper if Dr. Sola, gives us her contact, so you can also contact her directly. But in cases whereby you're not able to reach out to her, I'm also available. You could get me also to send her messages and all that, with your questions and all that. And we're also reaching out to you that if there are other, health concerns or topics you also want us to discuss, well, yours truly am always available. And that's why this page is actually dedicated to discussing those health problems or concerns that are actually pertinent to you. So, Dr. Shirley, please, how do we get you?
Sola Adeboyejo is the name again. You're physiotherapists. You have concerns. You could always reach me on 0906 4000 529. My email, which I'll always respond to easily, shola@gmail.com. I'll be glad to answer your questions. Thanks for your time out.
So once again, to my lovely viewers, it's been a beautiful time, and I hope you guys actually will have a lot of take home from this. I've actually gained more from this session, and with this, I'll say thank you very much. And like I mentioned before, I'm open to your questions and also your recommendation of health concerns you actually want us to throw more light on or discuss on. And with this, I'll say thank you very much till our next session. It's bye-bye and God bless you all.